Hi, my name is Dee Eaton. I'm the Senior Clinical Editor at Nursing Times. This video is the third in a 5-part series explaining how support surfaces can be a vital tool in preventing and managing pressure ulcers. In video 1, we looked at the fundamental science behind support surfaces and what causes skin damage. In video 2, we looked at static support surfaces, foam, hybrid and semi-dynamic systems. In this video, we will explore dynamic therapy mattresses. Dynamic mattresses are waterproof mattresses with a constant supply of air running through them. They're designed to be complete mattress replacement systems, so they can fit directly onto any standard hospital bed frame and usually have straps so you can secure onto the moving parts of an electric profiling bed frame. Once in position, you can inflate them. They are powered by air supply or control units that feed air into them via these tubes or air hoses. All air mattresses have a cover and zips around that can be undone, cleaned on the ward and then sent for decontamination. The cover is moisture vapour permeable, has a white inner lining to identify any strike-through of bodily fluid. You may have heard the terminologies one-way stretch, two-way stretch or multi-stretch. These terms relate to how flexible the support surface cover is and how easy it is for the material to move in different directions. Multi-stretch provides the most flexibility. The higher the stretch and movement, the greater the ability to counteract shear and frictional forces. The control unit plugs into a normal power point and is switched on at the control unit. This manages the system of airflow through the mattress. In more advanced models, the control unit has a dashboard that gives you different options for managing air supply and comfort. While there are 3 different types of dynamic mattress, they all look similar inside. If I zip back the outer cover, we can see that the mattress is made up of a series of inflated air sacs or cells. The different types of dynamic mattresses can be split into 3 main technology types: continuous low pressure, alternating pressure, low air loss. Each technology has a different mechanism of action which aims to reduce the pressure build-up underneath the patient. We will now look at each one in turn. A continuous low pressure, or CLP, is an air mattress that adjusts the level of air in its cells according to the demands placed upon it, weight and position of the patient. According to these demands, air is either added or removed from its cells. This ensures the pressure underneath the patient is kept low at all times, hence continuous low pressure, and there is optimal immersion. In this way, it controls the way a load is distributed across it. And that is why it is categorised as a reactive therapy. Looking back to our pressure equation from video 1, we know that pressure equals weight times gravity divided by surface area. A continuous low pressure support surface aims to increase the surface area in contact with the patient and therefore lowers the pressure. You can see the mattress here attached to some tubes and a control unit. When a patient is on a continuous low pressure mattress, the mattress automatically adjusts the level of air in the cells according to their weight and movement to ensure optimal immersion. This creates a bespoke profile for every patient. Every time the patient moves or repositions, the air is adjusted accordingly, hence the term reactive. Now let's move on to look at an alternating pressure mattress. You can see it looks similar, but in contrast to a continuous low pressure mattress, this mattress does not react to a patient lying on top. Instead, an alternating pressure mattress mechanically adjusts the air inside it on a periodic cycle so that its air cells take it in turns to inflate and deflate. This cycle enables the mattress to control the way a load is distributed across it. We have periodic offloading in the deflated cell, while the inflated cell supports the weight of the patient. For this reason, this mattress is categorised as an active therapy. The cells in an alternating pressure mattress are programmed to inflate and deflate at intervals, providing air movement in set cycles. As one cell inflates, its adjacent cell deflates. This pattern normally occurs in 10-minute cycles, so that every 5 minutes a single cell will deflate and inflate. This cycle cannot be altered by a user. Some advanced systems allow you to alter the cycle length, i.e. how often it changes under the patient, from 5 minutes to 20 minutes, dependent on patient tolerance. Traditional mechanisms place air from deflated cells into inflating cells. This means air in the A cells doubles, as does the pressure, and this ensures the patient does not bottom out. However, it also means that the surface area in contact with the patient has now essentially halved. Let me bring in Joanna Swan, Senior Lecturer in Tissue Viability at Birmingham City University, who can talk us through some of the questions that typically arise around dynamic therapy systems. So, Jo, are these therapies popular and how can you choose between them?
So continuous low pressure and alternating pressure systems are probably the two most common of dynamic therapies in healthcare settings, and it can be really tricky to choose the correct one for your patient. So it really is vital that you do a really good patient assessment, a holistic assessment of the patient. We need to be thinking about the patient's weight, their mobility, skin condition, and pain also is important. But we shouldn't forget patient choice also. Some patients have perhaps had a bad experience of an alternating system previously, so education and communication with that patient to try and understand what the problems were, to then be a bit more flexible about the system that you might choose for that patient is really important to get them on board with the care that you want to give. So there's no published clinical evidence to suggest that there's one therapy is better than another or more effective than another. And some patients do struggle with an alternating system beneath them, with cells that inflate and deflate periodically beneath them. And they do complain sometimes of feeling quite seasick. So in some advanced systems, the control unit does allow you to program different cycles, maybe some comfort control, and that's for specific blocks of time to suit the patient preference or the tolerance of that patient for that system. So there are advanced dynamic systems that can offer dual modality, so alternating pressure and continuous low pressure, and that can aid with the clinical choice and also to suit patient tolerance.
And do both of them offer zero pressure for patients?
No, it's important that we try and avoid terms such as pressure relief or zero pressure, because it's impossible to achieve unless the patient's literally levitating above the surface. So the European guidelines introduce terminology such as active and reactive and asked industry to avoid using the terms such as pressure relief to try and clear up some of the misunderstandings around the technology and what it's able to achieve. And we have to remember that no mattress, whether it's active or otherwise, can actually completely remove the risk of pressure ulcers developing. It's really important that based on our patient assessment that we're repositioning that patient at regular intervals, because we have to think this isn't just about trying to prevent pressure ulceration, but we need to consider things such as patient comfort as well.
Now let's look at the third and final technology classified under dynamic therapy, the low air loss mattress. A low air loss mattress looks very similar to the other mattresses in the dynamic family. It's an air mattress that has an air supply unit attached to it. It's only when we come to look at one of them closely inside that we can see an important difference. We can see that the cells within a low air loss mattress has a series of tiny laser cut holes in it. However, low air loss systems are normally attached to a large air supply unit so they can keep up with the volume of air that's needed. Low air loss mattresses are also classified as a reactive therapy type, as they react based on a patient's weight and position. Just like other dynamic mattresses, a low air loss surface has a supply of air constantly blown into it. Its key feature is that it has holes that allow for microclimate control. Each cell has tiny laser-cut holes that allow air to be dispelled based on the patient's weight and position. Pressure is redistributed evenly across the mattress. The air supply unit constantly blows air inside the mattress, minimising the risk of it bottoming out. Let me introduce you to Deborah Wickens, Lead Tissue Viability Nurse for Barking, Havering and Redbridge University Hospitals NHS Trust. So, Debbie, what are the advantages of this sort of technology and does it have any drawbacks?
This low air loss system can be really useful, especially for our plus size patients, and that because it provides a microclimate management system, and it does that with laser cut holes which keep the skin cooler and drier. That is really useful for plus size patients who may experience excess sweating, other types of moisture against the skin which can be damaging, and some of the mattresses will also have spacer material which creates a gap and further enhances that microclimate, increasing patient safety.
So I understand air mattresses have many common functions. Can you explain them and the importance of them?
Absolutely, there are many common safety and comfort features to mattresses. One of them you might hear called the max inflate or auto firm function, and what that does is create a stable platform where the mattress is auto-firmed, and what that does is to reduce the friction forces and the shear forces that the patient experiences, and it's important for two reasons. Firstly, for the patient. So for the patient in auto-firm, it's much easier to reposition or to get yourself in or out of bed, and secondly, for caregivers who may need to provide something like hygiene care, they can safely move the patient around the bed, and instead of those shear and friction forces, you'll find the patient gliding rather than dragging across the surface. Those auto-firm and max inflate settings will normally last for about 20 minutes and then reset back. That's because they're not therapeutic, they're not reducing pressure in the same way while in auto-firm sessions, so they need to switch back. You'll also hear a number of audible alarms on the majority of mattresses. It's really important to pay attention to those alarms as soon as you hear them, because it could be that the mattress is becoming less therapeutic and that the patient may settle onto a firmer surface if the mattress deflates. And then lastly, all mattresses will have a CPR function, and that's so you can form effective chest compressions if the patient should require resuscitation.
So, Debbie, what about other functions such as comfort adjust and zoning?
Okay, really important. So comfort adjust can really help us enhance our patient comfort. Not available on all mattresses. Some mattresses in the community might not have this. But if you think about yourself and your partners and things, we all like firmer or softer mattresses. We all have our own likes and dislikes. What comfort adjust allows us to do is to adjust the softness or the firmness of the mattress, but stay within the therapeutic window that provides them with the right surface that they need, the right mattress that they need to prevent jeopardising therapy but maintain comfort. So another thing that many mattresses will have is zoning, and they will have specific zones that support patient morphology. So one of the things that you might think about is the head. So some will have static head zones. If you imagine lying on a mattress with cells inflating and deflating, that could make you feel quite uncomfortable, quite dizzy. So this static mode will prevent that. The other thing to think about is the heels. The heels are an area where pressure damage can cause real problems for a patient. And some mattresses have lower cell depths around the heel area. What's really important is that you actually get the patient's heels into that area so that they are offloaded. So you need to be careful if you've got a taller patient. Some mattresses will have functions, advanced functions where you can move the heel zone. Other than that, you might need to think about adjunct therapies in order to float the heels. That might include things like a pillow or specialist offloading boots.
And does it matter if you put a top sheet over such a surface? Does that affect its performance at all?
No, it's absolutely fine to use a loose top sheet. What we don't recommend is too many other layers between the patient and the mattress, because that can affect the therapeutic delivery of the mattress's functions. It's important that it's a loosely fitted sheet. Sheets that are tucked in and too tight can cause hammocking. In the community, advising patients and carers not to use fitted sheets is really important as well, because that can increase those problems.
So why might a patient need to be stepped up to a dynamic mattress from, say, a foam mattress? And what patient groups benefit most from these type of mattresses?
So patients might need to be stepped up to these mattresses if they've got more significant skin damage, for instance category 3, category 4 pressure ulcers. And there's a group of patients who might need these mattresses because they're at additionally high risk of getting a pressure ulcer because they are, for instance, less mobile and are therefore high risk. And for instance, patients in intensive care might benefit from dynamic or fluid immersion type systems. We consider them a step up from foam in terms of the amount of pressure redistribution that they provide. And we always need to remember that as well as stepping up, there comes a time when we need to step down. So as a patient improves in terms of their skin integrity and their health, stepping them down to a foam surface will mean that we don't inhibit their independence on the less stable dynamic surface.
When it comes to choosing a dynamic air mattress, there is unfortunately minimal evidence to help us weigh up the relative effectiveness of one therapy over another. Nevertheless, it's important that we understand how each type works to support pressure redistribution. And it's also important to understand each patient's clinical need and what best suits them, as well as what they can tolerate. If one of your patients requires a dynamic air mattress, check your workplace's mattress protocol. It's likely to recommend a particular model. You may find that the criteria for prescribing one includes presence of existing skin damage. Most are suitable to treat up to Category 4 pressure ulcers. You may also have a step-up and step-down selection process to guide you. Some facilities allow clinicians to access 2 different types of dynamic surfaces that can be selected based on clinical need. For example, you could choose a medium high-risk air mattress for a mobile patient as it has a lower cell depth. A high or very high-risk mattress with increased cell depth and more advanced features, such as the ability to alter cycle time, may suit a dependent patient. It's important that clinicians assess their patient on a regular basis to see if their clinical need has changed and decide whether they need to be stepped down to a lower therapy or stepped up to a higher therapy. By utilising a step-up and step-down process, it enables us to be acutely aware of the stage the patient is at and select a support surface based on individualised needs, which can ultimately help with patient recovery and rehabilitation. It also helps us to ensure that appropriate equipment is being utilised at all times to avoid overutilisation of products. In this video, we have demonstrated how dynamic support surfaces are designed to optimise immersion. We've shown you their inner workings and explained how they operate. We've demonstrated their features and safety functions. In the next video within this series, we will explore stepping up your therapy support surface to a fluid immersion simulation therapy mattress or an air fluidised bed.